Hello and welcome back to the Follow Your Spark podcast. I have in front of me Sam Zisow-McClean, an incredible human that I am just getting to meet and get to know, and I am so excited to have them on the podcast with me today. Sam is a public health nutrition professional with 14 years of experience delivering high quality community nutrition services. They are driven to ensure these services are available to all people, especially those who were historically denied access to appropriate nutrition care and healthy foods. They currently serve as the director of programs for Moveable Feast, a nonprofit community-based organization serving Marylanders living with chronic illness and food insecurity. Before Moveable Feast, Sam worked as a registered dietitian nutritionist in clinical settings focusing on HIV and renal nutrition. They received a Master's of Public Health from Johns Hopkins and a Bachelor's of Human Nutrition from Eastern Michigan University. And I got connected to them because I am going to be participating in Ride for the Feast for the first time this year. And I'm so excited to hear more of your experience. I wouldn't say I'm nervous, but yeah, there's some feelings leading
That's
up to
real.
that. So I'm
That's
really
real. Yeah,
excited to have the conversation. So thank you for joining me.
absolutely. Glad to be here.
Awesome. So, the first question I always ask people is when you hear that phrase, to follow your spark, what, if anything, does that mean to you or make you think about?
Sure. I think that kind of prompts, living in alignment, right? And letting your values drive how you engage in the world. And so, to that end, I think being involved in Movable Feast and being involved in things like Ride for the Feast give me a real opportunity to do that, right?
Absolutely. So, it sounds like knowing your values and living in alignment with them. Like that's what the
Right.
spark means to you.
Right,
Yeah.
definitely. And noticing, I think not being afraid to notice when you're not living in alignment with them, right?
Hmm.
Letting yourself take those little nudges to
Yeah.
think about what
Wow.
isn't sitting, right?
Mhm. Yeah, speaking of which, I'm curious if you can share some tipping point moments or sparks that led you to the work that you do. Like, what had you become so passionate in this work, and any tipping point moments that you want to share along your journey?
Sure, sure. So like my background, I would say specifically around feeding people, right? Like grew up in a pretty involved family that, was engaged in things like kind of traditional charity work, right? And so sort of coming from a background of a family that cared about making sure that people have their basic needs met. And then sort of, I would say that kind of in your terms, like kind of the tipping point for me specifically with nutrition was going through a health crisis myself, right? Being diagnosed with an autoimmune disease in my late teens, right? So I was quite young. And at the time, just wasn't really getting very good care. And also, had a doctor, my diagnosis process was not the best and kind of asked the doctor, well, like, what should I be doing? Right. And the doctor was like, well, take your medicine and hope for the best. And that's
Mm,
an extremely unsatisfying answer. And I mean, of course, it's true, right? Like, there's an element of that, but also, what else could I be doing to be
yeah.
healthier? To be, what are the things that I can work on that I have some control over? So that's what really, honestly, prompted me to to start learning about nutrition and then to make that into a career, and then being able to marry that with doing clinical nutrition in a community setting really kind of
Mm,
brings those two passions together.
yeah. And it sounds like that's an example of the in alignment and out of alignment, of the
Yeah,
alignment with the values being like, okay, you grew up in this family where charity work was a part of your life, and that sounds like that's a value. And then you went through this obstacle. And I was like,
yeah.
well, this is not ideal for me. This is not the experience I would have hoped for or wished for. And it sounds like that was a motivator to get involved in this work.
Definitely, and also it gave me the visceral experience that so many people have of not being heard, right? Like not being listened to, not being connected to medical care, like not being honored in their medical care, right? Which is just sort of baked into some of the ways we've set up medical institutions, and obviously it doesn't work very well, right? It doesn't keep people healthy, and it's also doesn't kind of value people as individuals and participants in that system.
Totally. And I hear this so frequently of people experiencing a challenge, and that's like the main catalyst that
Yeah.
leads them down the work that they do. And while on one hand, maybe people wouldn't have wished for that challenge, it also gives you embodied experience, like you said, of what it's like to navigate this. And sounds like more compassion or care or dedication to serve people going through the same thing or something similar.
Yeah. Yeah,
Mhm.
absolutely. And I want to be clear, like I've experienced just such a tiny fraction of this, right? Like I have so many different privileges. Like for someone who is, economically stable and educated to experience those types of challenges, right? Like what does it mean if you don't have those benefits going into it? So
Mm,
that's really where it's like, how do we make sure that people who are having the hardest time with the system
mm,
are the ones that we're really lifting up?
beautiful. Yeah, which kind of brings me to for people who have never heard about Movable Feast, can you tell us a little bit more about what is Movable Feast? What is the work that they do?
Absolutely. So, Moveable Feast is a nonprofit community based organization. We were founded in 1989 as a response to the HIV epidemic. And really, what that comes down to is people were ill and dying and abandoned, right? And so, people who started Movable Feast started cooking food, bringing it to people, really driven by that commitment to the fact that everybody deserves food, everybody deserves dignity and community. And so that's still what we're here to do. Our services evolved. We now serve Central Maryland and the Eastern Shore of Maryland, and we provide people with a variety of chronic like nutrition sensitive illnesses with medically tailored meals.
Mm,
So that specifically meaning meals that have been designed by a registered dietitian to meet specific nutrition requirements for different illnesses. We deliver those to people's houses with the services of registered dietitians. So we're also doing the nutrition counseling and education. And, so we do that throughout our service area. And I think we'll talk a little bit more about some of the ways that people can get involved in that. And one of the ways that our services have sort of evolved. But I also want to flag we recently are really proud to have been accredited by the Food as Medicine Coalition, one of the first 10 organizations in the country to get this
wow.
certification for the accreditation with the medically tailored meal standard. So we're really excited about that as
Amazing. Congratulations.
well. Yeah.
And I'm curious too, you said from your experience when the doctor was like, just take your pills and hope for the best. Like, what have you noticed with the people that you get to serve, of having them be able to go this route, follow this route of food as medicine?
Yeah, I think that on a very personal and individual level, people resonate with that, right? They understand that what you eat has a huge impact on your overall health. And so I think there's been a real groundswell of enthusiasm for
Mm,
that, for food as medicine as a movement. There's, the evidence base is building. We've been able to participate in that at Movable Feast in terms of engaging in research and evaluation projects, and also in terms of like partnering with health institutions. So we're now partnering with hospital systems and insurers and practices to
mm,
contract to provide these services for folks because we know it makes a difference in their healthcare outcomes and their
mhm,
their healthcare costs. So, and I think it is really interesting in the like the health from the health aspect. So we started serving people with HIV. Still, about 35%, I would say, of our client base is people living with HIV. So still really substantial.
mhm,
And also the concerns that we're treating specifically for people living with HIV have shifted. I mean, I started at
mhm,
Movable Feast actually in 2009 as a dietitian, and then it was there for a few years and then left and came back. So I have a second time around there. But even 15 years ago, the nutrition concerns that we were treating in people with HIV were really different from what we're working with now. It was in the process of making that transition from sort of, fatal disease to chronic disease, but we were still seeing a lot more wasting and other things that we see much, much less frequently now. So now really we're working with folks often on comorbid conditions like diabetes, heart disease, kidney disease, and then also conditions of aging, both across our population, working with folks as they age, develop other conditions, and also might encounter, some of the challenges that come
yeah.
along with that.
Yeah. So it sounds like over the years it's been more and more accepted, this path. Like you said, you just got accredited and things
Mm-hmm.
are changing. One thing I'm curious about when I think about food as medicine, and this might not be relevant or not resonate at all, but what's coming to my mind is that just the act of feeding people feels so nourishing and impactful. And I'm
Yeah,
curious if you've seen any like impacts of just like, let alone whatever the food is. Like I'm sure the
absolutely.
food is amazing and nutritionally like valuable and all of that. But just the fact that someone is caring for them, like what impact have you seen, if any, on the community?
Well, that's massive. And I mean, I'll share a story that I've shared before, but it sticks with me. It was my first home visit. So we do home visits with folks, the dietitians do, and less so now. Honestly, it's a lot more telehealth. But, I always remember that particular instance because I went to offer a hug right at the end of this visit, and the woman I was seeing broke down crying. And what she said, and again, this was 15 years ago, and she said, I don't initiate contact with people because I assume that if they knew I was positive, they wouldn't want to touch me, right?
Mm.
Like that was an experience for her. And I do not think that is an unusual experience, right? I don't, that is not like it was shocking to me at the time, but it is not shocking to me in the context of still how much stigma exists in the world. So
Yeah.
just saying yes, 100%. And I mean, there are a million stories like that from, staff engagement. The way we care for people is absolutely, part of what makes this work, right? This is also, we are really proud of the fact that we have a team of drivers. So our food is all delivered by our staff drivers or by volunteers, right? So we do have some volunteers. They come on and really build relationships with folks as they're dropping off food,
Mm.
taking food to folks. And our staff drivers, I mean, we couldn't have a better team of drivers in terms of folks who
Mm.
really can connect with our clients. And it is really funny because sometimes I'm like, you can't spend 20 minutes at each stop. Please keep, you have to get through your route. But they really do build wonderful relationships, and
Mhm.
and it matters. I think you're absolutely right that the sense of being cared for, the fact that we do this in a way as much as we can to be as client centered as possible, right? That we really
Mhm.
want that feedback, really want people to tell us how the service is working for them. That really
Mhm.
matters. And I agree. We can't measure it. We can't say, a randomized control trial, you get a porch drop off and I guess you could. But it's hard to quantify that impact, but absolutely does the personal impact matter? Absolutely.
Yeah. Yeah. And
And
I
you'll
just
see
think of
it
like a
too. Sorry. I was going to
oh.
say you'll see it if you haven't with Ride for the Feast too. The community around Ride for the Feast is really
Mm.
outstanding and decades long relationships and friendships from that.
Yeah, awesome. It just makes me think of like a meal train, like when someone gives
Hmm.
birth or someone
Yeah.
dies or someone's sick, like one of the first things people think about is how can I make sure they're fed? And it
Hmm.
just seems like this very human instinct of
Yeah.
showing care through, like you said, everyone deserves to be fed. Everyone deserves nutritious, wholesome food.
Right.
So it seems like very baked into that.
For sure.
Yeah. So you said Movable Feast started in 1998, was that what
89.
you said?
Yeah.
89. Yeah. So it's been a little while now, and it's like COVID and everything, and you said how
Hmm.
long have you been with the organization?
So I've been with the organization in different capacities since 2000. And so in different capacities includes as a volunteer, right? During those years that I wasn't staff. And yes, so a whole lot has changed. The organization has transformed in various
Mhm,
ways since that time, including our funding structure has changed completely. And I say that because that, dictates in some ways what populations we can serve. We
mm,
were started as 100% Ryan White funded program, right, which is HIV, federal HIV funding. And now, that's about between 20 and 25% of our funding is federal at this point. So that's really shifted. And then of course, I think we've continued to refine our intervention in terms of what diets we offer. What are our nutrition standards? What does that process look like?
mhm,
And also going through things like COVID and having to completely pivot from, we're heavily volunteer supported, and so pivoting from having 150 volunteers a week through the kitchen to zero, right? And how
yeah,
does that impact them? So we're a staff of about 35 fully
mm,
staffed, and we put out between 400 and 450,000 meals a year. So you can see
wow,
how much we must rely on volunteers for that, right?
yeah,
And also have to be really sort of nimble and responsive to
yeah, everything,
changes and unpredictability. Yes.
yeah. Yeah. What helped you or what was the biggest, yeah, thing that supported you as an organization or you in the work that you do through COVID? I'm sure that was like a
Mm,
very kind of chaotic time, I would imagine.
definitely. I think that really it's being able to rely on staff, right? Being able to rely on each other. Also being able to have hard conversations and kind of lean
Mm,
in on making hard decisions together, right?
mhm,
I think a lot of it comes down to the team, and we had tremendous support from the community, and
mhm,
both in terms of like individuals and also like foundation support to help us get through that. And times are uncertain. We're still in uncertain times for different reasons. And a lot of the same lessons, I think, are applying. It's like we're really
Mm,
having to do a lot of contingency planning
mm,
to let our values lead. I think that's got to be front and center in terms of how we address any of this uncertainty is what is our mission? What are our values? And how do we make sure that we're putting clients at the center of that and building from there?
yeah, yeah. So I kind of like back to the beginning of this conversation when you said that spark is how you're aligned and connected with your values. That sounds like something that's a key piece of navigating change and challenge, whatever comes up. It's coming back to, okay, what do we stand for? Who do we serve? How can we best adapt, whatever we need to adapt in order to live in as true alignment with that as possible?
Yeah, and to make sure we're making strong decisions to continue to serve people for many decades to come, right?
Mhm. Yeah. Yeah, and I'm curious if as you look ahead to the future, is there anything that you see Movable Feast evolving into, or
Mm.
what is the biggest thing that you guys as an organization might be excited for or working towards?
Yeah. So I think so. What's exciting is we know what we do, and we're really focused on what we do. We know what we're good at. We're focused on it. We have really one of the things that shifted even coming out of COVID was we have a very tight focus on the home delivered medically tailored meals. So there have been times in the past where we have done things like congregate meals or drop in center meals, which are excellent things to do. But what we've realized is that our expertise lies in the medically tailored home delivered meals. And so we're really all in on that.
Mm,
I think that the thing that's the most exciting to me, if we look at the kind of medium term, is thinking about how we really further embed this intervention in the healthcare model, right? And
mm,
so, in a very big way, that means things like Medicaid and Medicare, but it can take a lot of different forms. How do we make sure that anyone who needs this intervention is able to access it, regardless of, whether they can pay for it or whether they have, right now it's like kind of look at the draw if you happen
mm,
to, your referral source happens to know about interventions like this and gets you connected, or you have the right insurance that has decided to cover this. And really thinking about this from an access and equity perspective. How do we make sure that this is something that, just like now, I don't mean to, I recognize in saying this that medication is also not everybody who needs a medication can get it. We need to keep working on that. But if you need a medication and you can access it, I'm thinking about this the same way.
mhm,
Yeah.
mhm. Yeah. And is this like long-term vision would still be around serving this area, or is there like things you're working on that might impact countrywide or broader
Mhm.
or statewide or
Yeah, we are very focused on our service area, which, as I mentioned, is all of central Maryland. So as far west as Carroll County, as far south as Anne Arundel and Howard, and then all the way through the eastern shore of Maryland. There's an organization that has a very similar background to us that we've worked with, for 30 years, Food and Friends in DC, that serves western Maryland and southern Maryland, as well as the DC suburbs. And so between us, there is coverage for this intervention throughout the state, which is something that a lot of states actually don't have. We are also members of the Food as Medicine Coalition, which is a coalition of organizations like ours. It came out of most of them coming out of the HIV epidemic. And that coalition is doing a lot of work, a lot of advocacy at the federal level, and is also working on helping to support agencies that are developing into this work for medically tailored meals. So there's an accelerator program. So we can, share resources, but it's Food as
Mhm,
Medicine Coalition. It's fimcoalition.org. And so great place to check out. Also has information on the accreditation standards. Like when we
mm,
say what we're providing medically tailored meals, right? What does that mean?
mm,
And
mhm.
until pretty recently, there wasn't a standardized definition. So we're
Yeah.
really excited for that.
Nice. So one thing that I heard you say, you talked about getting clear on your expertise and doing
Mm-hmm.
what you do best. So it sounds like in the future, continuing to hone in on that focus versus think about all the there's so many beautiful things that you could be doing and
Lots of
what
bright,
can
shiny
we
things. Yeah.
yeah, what can we do the best to the best of our ability and really focus on excelling in that area.
Yeah. And also highlighting though, like I said, we're really focused on medically tailored meals, but we need a whole range of interventions, right, that are available for folks. And so I'll highlight also one that we're working on with is a collaborative with Meals on Wheels of Central Maryland and the Maryland Food Bank. It's called FAST, which is the Food Access and Support Services team. And we've partnered with the University of Maryland Medical System to test an algorithmic referral which
Mhm.
is really exciting. So basically looking at all of the utilization in the University of Maryland hospital systems, checking for risk for food insecurity, and then matching those highest risk folks with the correct food intervention. And so the reason I think that's so exciting is it really does create networks around people, and it's helping us move closer to making sure we get people the right intervention for them, because some people are going to need medically tailored meals. Some people are going to need a healthy grocery box from the food bank or
Yeah.
Meals on Wheels, right? And so making sure that we have that kind of network of services available to catch people, you know, at any point in time, and including when their own circumstances change.
Yeah.
And so I think continuing to build, I think that is an area of growth for us, no question, is how do we continue to build that network of services that help efficiently get people the right service and also support the community-based organizations too.
That makes a lot of sense. And one thing I'm curious about for people listening to this podcast, maybe they work in the nonprofit field, maybe they're just interested in community support, community organizing. This may be a broad question. And I'm curious if there's any like biggest lessons that you've learned from working for Movable Feast for this long that support the work that you do. For example, what I'm hearing, like three top things that I'm hearing is like clarity on your vision, values, mission is important. Another thing, like having an expertise and doing what you do best. And I also heard the power of collaborations and networks and partnering with other people when you know that, this might not be your specialty and you want to be able to offer the support. So is anything else like coming to your mind right now when you hear that?
It's a great summary. I'm gonna like take that and like I don't know, put it on my resume or something. Yeah, I mean, I think I just kind of dig in a little bit more on that last one, because I think one of the things that I've learned and that continues to be true is how much relationships matter, right? Like our relationships, this project, this collaborative with Meals on Wheels and the food bank, it really relies on a lot of trust, and a lot of trust built
Mm,
over years of working together, being willing to get together and get in a room and say, okay, what could we do? And
mm,
not having this be a relationship built on kind of scarcity or
mm,
competition, right? Is
mm.
saying, what can we do? What's the additive here, right? Like, what can we do if we're working together? That really has borne out this really innovative project. And so I think the relationships matter and the way you do the work matters. And I think I had one more thing to say about that I've now forgotten, but we can come back to it.
Yeah, if it pops in your mind. But yeah, I love that. And it's interesting. I'm part of a group right now that we're trying to figure out what it makes sense for us to be a nonprofit or what kind of like structure would we want to create. It's a community-centered kind of group. And what you said of relationships matter, trust matters. You said people like getting in a room and having a conversation, like that's really what it looks like for us right now. A lot of conversations, a lot of talking about the values and the mission and everything that we stand for, and yeah, I just feel like there's this energy in the air. Like, let me know if you sense this at all, but just energy in the air of people asking more of these questions of how can I serve my community? What does that
Mhm.
look like? Like, how could it evolve? How can we collaborate and co create together? So I think it's just really interesting to hear your perspective and things for people to think about if they're asking themselves these questions.
Absolutely. No, I mean that's, it's interesting because Movable Feast, we have portions of that energy, right? We're also an established organization with 35 years of history, right? So we're not at that beginning like everything's possible stage. And
Mhm.
and there's pluses and minuses to that, right? But I think that can be really delightful, and we do get that in certain projects.
Mm.
Also, there's real, what's the Brene Brown, what does she say? The messy middle. There's real
Yeah.
messy middle, after that delightful, like, oh my God, everything's possible. We could do so much amazing stuff. And then you get into the real stuff. And I mean, it's unavoidable. And so like
Yeah.
going in with the expectation of, okay, we're going to bump up against stuff here. It's going to be messy at times. It's going to be difficult. And, that we're willing to engage in that together, broadly, I think is part of the key.
Yeah. Thank you for that reminder and that I can see myself through my own journey too. Because at the beginning, we were all just like, "Great, we're just, like, doing this amazing work," and,
Yeah.
there's not a lot of money involved. It's very, like, grassroots, and now when we're asking these questions, we're like, "Wait, structure, money, like, taxes, like, all these
Mhm,
different
mhm. It's
questions."
unsexy, pretty quick,
Yeah, and I
but
think the thing.
necessary, right?
Yeah.
Yeah.
And I think the thing that's keeping us going is like coming back to that question of like, why are we doing this? Why are we doing this? What is the mission? Is it important enough to us and what we believe the impact could be that we do this extra unsexy work?
Yep.
So I love that call out of like, yeah, at the beginning it might be all rainbows and butterflies in the honeymoon phase. And then
Hmm.
there will likely come a time, maybe inevitably come a time where there's challenge and, things that come up. And can you come back to those values and the mission that got you started in the first place?
Pausing this interview for a moment to ask, as you're listening to this episode, what ahas are showing up for you in your life? What spark, dream, or vision are you feeling called to pursue? As you heard in this episode, something incredible happens when we give ourselves permission and space to pursue what truly lights us up. I believe when we do that, that's when we have the most positive impact on ourselves and everyone around us. If you are ready to believe in yourself and your dreams and courageously pursue them, coaching can help. So often, what's been holding you back is different than you think. And it doesn't matter if you've tried before and failed, that is no indication of what you are capable of. If you're ready to discover how to overcome your challenges and expand into what's truly possible for you, let's talk. I offer free clarity calls where we'll explore what you'd really want to pursue if you believed anything were possible, and you'll walk away knowing exactly what it would take to get there. Something incredible happens when you believe you're capable. You start taking steps towards your dreams instead of waiting until you're ready. This call alone has the power to change your life. If you're ready to take that next step, go to GinaCasbarra.com/clarity call to book a time to chat today. No more waiting. It's time to live your most authentic, inspired, passionate life. I can't wait to connect and hear about what that looks like for you. Now, let's get back to the interview and I'll talk to you soon.
Yeah. And how can you set some structure at the beginning when you're all in love, right? To help support how are we going to deal with conflict when it comes up, right? Because it's gonna,
Mm,
and it's all about how you kind of move through that together, right?
yeah.
I'm very grateful. I mean, this is definitely part of our practice at Moveable Feast, and we have a team that is really willing to do this, which is, I mean, outstanding. So, like, major shout outs to all my colleagues who are doing hard work and being willing to engage in the messiness of it as well.
Yeah. Is there one thing that you can share that maybe you guys do as a team that helps you deal with conflict or obstacle?
Yeah, I mean, I think a few things. One is we have group agreements. I'm speaking specifically about the leadership team, but a lot throughout the organization as well. So we have group agreements. We revisit them, we revise them, we do our best to like adhere to them and to be willing to remind ourselves and each other if we're not,
Mm,
for falling outside of that. So just engaging with each other in good faith and with it as an invitation to our values. So I think that's been when it's really, really basic. And then also we've done a lot of work just working through group norms and agreements in different bodies, different committees, different, every group is going to have slightly different variations on that. And then just kind of setting the expectation that we have to be willing to have hard conversations and lean
yeah.
into it.
Yeah. And like you said earlier, I would imagine trust and a foundation of
Yeah.
relationship is important. And yeah, it sounds like the clarity of expectations and the willingness to have the hard conversations sound, yeah, all foundational.
Yeah,
So,
definitely. And that's something I've learned, I mean, from my colleagues and with my colleagues, right? Like that's something that I feel like we continue to evolve. And so really grateful for that.
yeah, that sounds like a beautiful team. So let's talk about Ride for the Feast.
Yeah.
How long has Ride for the Feast been happening? Is it like go all the way back?
Not all the way back, and shoot, this is a thing I should have looked at before I got on the podcast, but it's more than 20 years. I think we're at maybe like 23 years. I'm thinking like 2012. No, not 2012. I meant like 2002 might have been
Okay.
the first year. So because for somewhere between 20 and 25, I think, and my
Hmm.
colleagues will correct me and we'll if we need
20
to.
plus years.
Yeah, more than 20 years. I got involved. 2010 was my first ride, and I've been involved in some way every year since. I would say I probably have ridden maybe half of those and volunteered or fundraised maybe half of those would be my guess.
Mhm.
And it's changed a lot over time,
Mhm.
but still has sort of the core people who care about something a whole lot, taking on a challenge, right? To really demonstrate, I think, give themselves a challenge, give other people a challenge to fundraise, and really just have a lot of fun at the same time.
Yeah. Do you know how it was born? Like, who was like, let's, what the conversation was or what the
Hmm.
spark was that led to it?
So I don't know exactly. I do know some of the founders, and I'll shout out David Andrews and Becky Abernathy was there from the get go. And there are bike rides like this throughout the country. Not many of them. Well, I would say there are many that have come and gone, right? It's a hard thing to sustain. So the
Mm.
fact that Movable Feast has been able to sustain this, and I say this also, like I'm in the program side, I have nothing to do with Ride for the Feast, so this is just sheer fun for me. And so, my colleagues get to define Ride for the Feast and how it goes, but like from my perspective, I mean, I'm an avid cyclist. I've done, a number of events, and this is definitely the favorite. It has such a great mission and such a great crew of people involved. And so I think it's a hard thing to sustain, honestly. Events kind of come and go, but Right for the Feast has been really, really steady, really has been a fun place for people to kind of reconvene year after year, which is great.
Yeah. So now I'm present too. We haven't explained to people what Ride for the Feast is if they
Yes.
don't know. So A, can you tell them that? And
Yes.
B, what do you think helped sustain it?
So Ride for the Feast is a charity bike ride. We have various options. We have a 40 mile, metric century, which is like 67 miles, and a century ride, which is over 100 miles. And then we have new this year a 25-mile option as well, which really gives a lot of range in terms of people with various, levels of cycling interest and ability and time, right? Because the amount of time people put in training, really excited for that 25-mile option for people to be able to jump in and just kind of do it with less devotion of time. So it takes place in Talbot County. So in Easton, it's a loop, like a ride of one of those distances. It's well supported. So people come out and, we have pit stops, we have SAG vehicles, which is support and gear vehicles. So you never have to worry that you're going to get stuck on the side of the road somewhere. There's people around to help out and get you where you need to go. And then it's just always a nice celebration. And obviously, the point of it is to raise funds to help us feed people, right? And so everything we're raising from Right for the Feast goes directly into services and supporting this medically tailored meal and medical nutrition therapy provision for people throughout the Central Maryland and Eastern Shore.
Yeah, I'm
What has made
excited.
it successful? Like I think some of it is the mission, right? It's a compelling mission. People want to be involved in that. It's a very tangible way you can see an impact you're having in your community, and also just the community around it, where there are teams. And I would love for you to pitch out your team too. But lots of teams, right? Movable Feast, we have a staff team, Movable Beasts. So there are a few of us that ride from that. There's a ton of amazing teams that I won't shout out because then I'll shout out everybody because then I can't have any preference for Ride for the Feast teams because they're all my wonderful friends. But like that team environment is so much fun and it makes the
Mhm.
fundraising so much less
Mm.
onerous, right? I
Mm.
remember, I mean, when I started 15 years ago, I was like, the fundraising goal was like, I don't know, $1,300 or something. It was actually, I think, a little higher than it is right now, just because of the dynamics of how things change over time. And I was like, how am I going to raise that much? I have no idea. I don't know anyone who has that much. I can't, there's no way I can do this.
Mm.
And, a couple of like events later, it was like I'd hit the fundraising goal. So
Mm.
like being involved in a team like makes such a big difference too. And it also I think helps people get the practice of asking for support because I know that's a hard thing to do if you're not used to it, right? It can be like, well, I don't want to bother people. I don't want to. But doing events can make it a little more accessible and also just, a reminder you're not asking for you're asking for someone who really needs it. So,
Yeah.
if it helps you, that can help people, I think, feel a little more confident in saying, like, I know I'm asking for my community
Yeah. Yeah,
and
so I'm on
let's
team
meet it.
Tenderbits for
Woo!
this is my first year,
Mhm.
and a friend of mine invited me to participate. She was on the team last year, and yeah, I didn't know anybody else on the team, and everybody has been so welcoming and so friendly and so supportive and so encouraging. It's really been an incredible experience, and they've been doing training rides like once a month since January. I've been on one so far, and it was like 30 degrees or something outside. It was 1,500 elevation, and we did like 18 miles. And I'm not a super avid biker by any means. So I'm going, I have 3 pairs of gloves on and like hand warmers and
Yeah,
everything. And for sure, it was like that community support that kept me going, and just seeing all of them fundraise and get excited about it. There's definitely an energy that goes behind a community coming together for a common cause, for a common good. So that's already been an incredible experience.
that's great. So yeah, before coming to this, I knew you were affiliated with Tenderbits. I didn't know this was your first ride coming up.
It's my
So
first ride.
do you know what distance you're doing? Do you want to, are you,
I don't
okay.
know. I mean, I would love to say 100. I don't know if
Yeah,
that's realistic or not. I haven't been biking as much as I definitely could be.
totally. The
What's
only
your
reason I
advice?
say that, like, I don't say that to put you on the spot because if you change your mind, if you register for 100 miles and you change your mind, that's okay, right? Like, you can change the distance that you need to do, and it is really well supported. And so, like, I don't know. I'm not telling you what distance to do at all. I am saying if people are interested in challenging themselves and want to get engaged with folks who are challenging themselves to do a longer distance than they've done, or just do 25 miles could be the big challenge. I mean,
Mhm.
it's all about finding that kind of spot that works for you to feel like, wow, I really did something.
Yeah. Yeah. And I'm curious for me and anyone else listening, whether it's their first ride or maybe they're just hearing about it and they want to jump in. Like when is it too late? Like, 'cause if someone's like not a biker and they want to jump in, I don't know, what would you recommend? And just like
Ooh.
any other advice for first timers.
Yeah, I mean, advice for first timers is unquestionably get connected with a team, get connected with movable beasts. If you're coming to this and you don't have a connection to someone on a team, we are more than happy to make sure you get connected, or for you to ride with the staff team, whatever, like we're thrilled. It's all about getting people engaged. I don't think it's ever too late. I mean, I think there's some logistical planning, and so I don't know when the like actual cutout would be, but it's probably pretty close to the event. I
Mhm.
mean, obviously, if you want to fundraise, you can do that anytime. We will
Yeah.
always accept fundraising. But for the actual writing, I think if you have questions around that, reach out. Kevin Smith is our ride coordinator. He's awesome. He's super accessible, happy to answer questions. And really and truly, no question is like dumb. Like newbie questions are super welcome. There's all kinds of things about long distance cycling that's like, what should I wear? What is chamois butter? And it is important. So if you're coming to ride for the feast for the first time, make sure you have some chamois butter, which is the cream that you use under your bike shorts so that you don't chafe.
Yeah, I don't know what that is.
All of those things, but like these are things how would you know, right? So like don't hesitate to ask, I think is the
Mm.
big advice. And also do train. You may be an athlete that can hop and do, 25 miles or 100 miles without really training. But, definitely do some training rides if this is not something that you do regularly, and make sure you have a sense of what your body can do because it's
Mhm.
different on the event day.
Mhm.
Energy is a little bit high. It's an unknown, like a unfamiliar route, I guess is what I'm trying to say. And
Mhm.
also there's
Mhm.
always, you want to make sure you're paying attention to weather conditions, that you're bringing gear, like you said, with 3 gloves. If you need 3 gloves, bring them. And also just, I would say, ask any questions. No questions are too dumb or new, we welcome that for sure.
Yes. Yes. And it'd probably be good for people to know, when is Ride for the Feast?
That would be great to know. It's May the 17th, and we can drop links, I'm sure, but Ride for the Feast website is where you would sign up. You can find people to volunteer, you can find events. And if you want to get connected, I'm sure we can probably share Kevin's email in the show information as well, so that people can get directly connected and get any questions answered.
Yeah. How long do people have to do the full 100 miles? Is there a time limit?
There is a time limit. That's a great question. And I don't know specifically what it is. And I'm not sure I'm sure that's been determined and we can find out. If folks have questions about it, please reach out. The, yeah, I won't hazard a guess. I will say there is a time limit, and it's mostly to get you back in time for dinner. So,
Mm-hmm.
and again, if you go in thinking you're going to do the 100 miles, you're behind pace, it's not working, we're gonna pick you up and get you up through it. It's not like you're just gonna be stuck out there. So
Yeah.
there's not a problem with, like, you want to do your best to assess your own ability, what makes sense for you, and also you can still give it a shot if it seems in the realm of possible. If that doesn't work
Mm-hmm.
out,
Yeah. Yeah, that was definitely something I heard from the first like team meeting we have people that Tenderbits had them sharing that of there's just a lot of support along their way.
Yeah.
Everyone, there's snacks, there's water, there's support teams, all these different things of
And
people
there's
who
great
if you need
cheerleaders.
anything, cheerleaders,
That
amazing.
makes such a big difference. Is like, there's somebody like with a cowbell like cheering you in when you come into the pit stops and stuff. So yeah.
Yeah, I was never a runner either, but I used to work for Lululemon,
Mhm.
and they have a half marathon called Seawees that happened in Vancouver. And we would always watch the like recap videos and the parties and the cheer stations and everything else. And it just like
Mhm.
looked like such a party. And I was just like, if I have to run in order to go to that party, then I
Yeah,
will figure this out. So I trained and I did the half marathon, and it was one of the hardest things I ever did. But it was a huge party and it was super
that's great.
fun. So I'm glad to hear that there's fun cheer
Yeah,
stations.
it's a party with a bike ride attached. I don't know. It's that there's definitely, I mean, there are, don't get me wrong, there are some very serious athletes involved in this, but we are also very clear that this is a ride, not a race. So
Mm.
don't come to Ride for the Feast and try to set a PR, please, because what we want is for people to have a good time and get in safely. And, it's decent sized event. And, we want to make sure everybody gets in, gets safe, and we don't have any hazards on the
Mm.
roads.
Nice. Well, I'm definitely excited for it. And it sounds like the ways people can get involved, you can, of course, participate in this event, Ride for the
Yep.
Feast. You can be one of the people who bike. You said, can you also volunteer and
Yes.
not bike?
Absolutely. You can volunteer at the event. We need volunteers at all stages of this. There's check-in, there's pit stop. There are pit stops it averages, I think, about every 10 to 15 miles. And so we need people there to stock things, to answer questions, to have Band-Aids and ice water and snacks, and then also to make sure everybody checks in as they go through those. That's how we
Mhm.
keep track of people.
Mhm.
And then also you can be a virtual rider. You can sign
Mm.
up and you can set some sort of a fundraising and cycling goal for yourself. If maybe you're not in
Mm.
Maryland and you aren't going to
Nice.
make it here. There's ways to get involved that way. And then of course, just sharing and telling your friends about it. You see Gina's fundraising page and you pass it on Facebook or whatever. That really helps us as well.
Beautiful. Yeah, so it sounds like there's all kind of ways. And I would imagine volunteering, I would bet, is super fun of just like being able to
Yes,
participate in the event itself, even if you don't want to bike. So I love that
exactly. Yeah.
that's an option.
Yes,
So I
bring
would love,
your most ridiculous and loud clothes and gear, right? Because it's work, right? You're going to be doing work, and also you do get that energy of the event, the cheering and
mm, hmm
supporting each
amazing.
other, doing
I
hard
love it.
things.
Yeah. Well, as we're nearing the end of this
Mhm.
conversation here, I would love to know if there's one thing that people could take away that you'd want them to remember from everything that we've talked about. What might that be?
I I mean, I think it's really just I've been really lucky to find a place like this where my personal values, my work values get to kind of come together, right? And I get to help feed people for my job, right? Very lucky. And also, I think the thing to take away is to find something that aligns for you that may or may
Mm.
not be your job. Like I reckon these are often not connected in the way they happen
Yeah.
to be for me. But finding a place to plug in, and the community really matters, and these
Mm.
relationships and the support we're giving each other matter. Whether it's dropping, like you said, a meal train, right? Like that makes a big difference, and getting involved where people are trying to do the same type of work that you care about. It's altruistic, but it's also like part of your own well-being, right, as a community member. And so,
Mm.
just invite people to do that. And lots of people are doing that, and we're grateful for it. It's supporting Moveable Feast clients all the time.
Yeah, it's beautiful. And that reminder that when we support other people, we also support ourselves. And we're all part of this unit. We all impact each other and we all need each other. And to be
Mhm.
able to think about that and consider the impact that we have is what I'm hearing. Beautiful. Thanks for sharing. Is there anything that I didn't ask you that you want to share or is on your mind?
I don't think so. I think just, don't, if you have questions about Movable Feast or questions about Ride for the Feast, don't hesitate to reach out. We have a really great team, both in terms of staff and volunteers, and we welcome and hope you'll come get involved. Hope we'll see some folks
Awesome.
at Ride for the Feast.
Yes, I love it. Well, thank you again. I definitely have experienced the friendliness and welcomingness of everyone I've engaged with at Movable Feast. So
It's
thank you
great.
so much for being here and sharing about this beautiful work.
Definitely. Thank you.
Thank you so much for listening. I hope something in this episode resonated with you. I am so curious to hear, what is the spark on your heart that's calling you forward? What dream are you ready to pursue? If you feel this deep yearning for something more and yet the vision still feels unclear, let's talk. I offer free clarity calls to help you explore what truly matters, uncover what's been holding you back, and find out what simple, powerful practices you could be implementing that would propel you towards your dreams. I promise you will walk away from this call feeling inspired and lit up about the life you want to live, compelled by why it matters, and clear about the next steps you could take to get there. And like in all the work I do, I will invite in intuitive guidance by pulling oracle cards to open up to whatever messages would serve you most in this moment. Whatever it is that's been calling you, whatever spark or dream is on your heart that you've been holding yourself back from, it's time to stop giving yourself reasons why you can't do it. You are so much more capable than you imagine, my friend. If you'd love support believing in a bigger vision for yourself and actively taking steps towards making that possible, head to ginacasbaro.com/clarity call to book your free call today. You don't have to be completely confident before you pursue your dreams. What builds that confidence is taking steps one day at a time. So if you're ready to take that next step, book a call and let's discover what that could be together. The world needs more people courageously following their purpose, passion, inspiration, and joy. And I cannot wait to hear about what that looks like for you. All right, my friend, until next time, I'm sending you so much love and don't forget to follow your spark.